Good morning, everyone. Welcome back to the UBC Learning Circle, hosted by the Center for Excellence in Indigenous Health. I'm very excited today to welcome Ashley Lessard of the FNHA to chat with us about a whole bunch of stuff, but principally about the Children's Oral Health Initiative. Before we begin, I would like to acknowledge that we are on the traditional, ancestral, and unceded territories of the Hunkaminam-speaking Musqueam people. I would also like to acknowledge the First Nations Health Authority for generously funding the UBC Learning Circle. So the topics that we cover can sometimes be sensitive or emotionally triggering. And we say that for all sessions, so that if that's you for today, please make sure that you're looking after yourself. If at any point you feel unsafe, please take the opportunity to chat with a friend, an elder, counselor, or a family member, whatever your support system looks like. Please make sure you're engaging in that. Okay, so quickly introductions. In case you didn't know, my name is Cole. I'm from the Chowthil First Nation. I'll be facilitating the discussion today. Other Learning Circle team members in the digital room here today are Cynthia, our production coordinator, and Winona, our assistant coordinator. If you feel so inclined, please introduce yourself in the chat box as we kind of get the discussion rolling. And yeah, so we can all kind of get to know each other and enjoy the chat today. So I'm going to turn the mic over to Ashley, and yeah, please take us away.
Okay, thank you. Okay, good morning, everyone. My name is Ashley Lessard, and I am the Assistant Children's Oral Health Initiative, or Kohai Specialist with the First Nations Health Authority. I've been in my role for just over a year now, and prior to this job, I had worked as a dental hygienist in private dental practice for 6 years. My educational background is in dental science and public health. In my current role, I help manage and coordinate the Kohai Program with a focus on supporting the Kohai Aids with their jobs and their roles. I was born and raised in Tla'amin Nation, but now live, work, and play on the territory of the Hilkomelem speaking peoples. I would like to open this presentation in a good way by taking a brief moment to reflect and express my gratitude for living and thriving on territory that the First Nations of this region, specifically the Squamish, Musqueam, and Tsleil-Waututh peoples, have endeared themselves to since time immemorial. I feel both grateful and lucky to be here presenting to you all today on subjects that I'm very passionate about. I welcome you all, and I would like to thank you all for joining me. So during this session, I'll go through a few different topics: oral health of First Nations in BC, oral health and overall health and well-being, the Children's Oral Health Initiative, my specialty, and building community capacity for oral health. Before we dive into everything, I'll give a brief overview of the landscape of dental care for Indigenous peoples in BC, which includes a number of factors. In the center of this image are in-community services, ranging from providing emergency services to prevention-based programs. This includes the FNHA oral health programs, our dental therapy, and our Kohai program. Funding arrangements to partially fund communities with dental programs that offer a range of services. And then individuals who cannot access the care that they need in community may also utilize the medical transportation program through the FNHA to visit a dental office for services. These initiatives speak to the FNHA's directive number 1, which is community-driven, nation-based. FNHA acts as the health and wellness partner and supports community self-sufficiency by providing them with the help and support they need, ultimately reducing barriers for client access to care. Other factors that exist external to the FNHA include partnerships with the regional health authorities, educational institutes, dental colleges, and the dental professional associations, government programs that support target groups with access to care, regional health authority programs that offer some oral health education, screenings, and fluoride varnish applications for certain target groups and populations. And then also in 2017, the dental colleges signed a commitment to cultural safety and humility, recognizing the need to create a safe space for clients when they do access care. And then on the right side of this image, there's a box that represents the dental benefits that exist for First Nations clients through the Pacific Blue Cross Insurance Company, which I will talk about a little bit later on. This slide is a little bit more concise than the last one, and it summarizes what the FNHA oral health program includes. The Kohai program, health promotion and education, dental therapy, and support for community dental clinics and services. And now I want to talk about how a person is affected by oral health. Oral health does not just affect the body, it does not just affect the mouth. Research shows that oral health is related to the health of the body and the mind, and this makes sense. There are links between poor oral health and diabetes, heart disease, premature and low birth weight babies, and respiratory diseases. And in children, there's a link between oral health and healthy weight, learning ability, speech, and personal growth. For example, having good oral health can affect a child's ability to chew or speak, which in turn affects nutrition, self-esteem, and communication. And then the opposite can also be true. If a child has tooth decay, it can affect function and cause infection. It can also lead to pain, which affects the ability to focus, play, and learn. This all emphasizes the importance of oral health throughout a lifetime and setting a child up for a lifetime of good oral health early. And I just want to remind everybody that they can ask questions as I go through if they like. In pre-contact times, First Nations in BC and in Canada enjoyed good health, including oral health. Post-contact, the process of colonialism has resulted in a complex interplay between socioeconomics, intergenerational trauma, systemic racism, and health outcomes, including oral health. And in addition to this, many barriers to oral health exist for Indigenous people in Canada, including restricted physical access to dental care, racism, and systemic bias. Despite this, the First Nations in BC are resilient and are taking back control over their health. Every 3 years, a dental survey is done in BC on kindergarten children all across the province. In these surveys, the parents of the children have the option of self-identifying as First Nations. Therefore, using the results from the kindergarten surveys, we can get an idea of the dental health of Indigenous children in BC tracked over time. The most recently published BC kindergarten survey is from 2015-2016. The 2018-2019 survey results have not yet been published and released. So from the 2015-2016 survey, we can see a few things, that the percentage of visible tooth decay in Indigenous children is almost twice that of non-Indigenous children, and that the percentage of children without any tooth decay, past or present, is 25.6% lower in Indigenous children. Both of these measures essentially translate to meaning Indigenous children have more active tooth decay and a greater history of tooth decay. Saying all this, the trends in the BC kindergarten surveys do show improvements in oral health among both Indigenous and non-Indigenous children in BC, which is promising, but the gaps in dental health outcomes still remain. I'll go a little bit over tooth decay just to give a really brief overview. Tooth decay is a bacterial infection that can be easily passed from one person to another. When we're born, we don't have the bacteria that causes tooth decay and gum disease in our mouths, so our mouths are essentially sterile. And we pick up bacteria from other people through everyday common practices, from things like sharing utensils. I've also heard of pre-chewing food as something that some people do. And in order for tooth decay to occur, there must be three things present, and it makes sense. You have to have teeth first in order to get tooth decay, bacteria in dental plaque, and then sugar or carbohydrates. So sugar has many different names. Oftentimes it ends with "ose," so there's fructose, glucose, sucrose, all of those sneaky things. And then tooth decay happens when sugars or the carbohydrates feed the bacteria, which then produce acid as part of their metabolic process. So they eat the sugars and then produce acid, which damages the tooth surfaces. Over time, this can cause a hole in the tooth to appear, sometimes also known as a cavity. That's the common term. And then early childhood caries or tooth decay is a term that's used to define tooth decay that occurs in children age 0 to 7. Early childhood tooth decay has a characteristic pattern with it often starting in the upper front teeth, which it can be an area difficult to clean, and also can be caused from baby bottles. Having anything other than water in a bottle can cause the tooth decay in the front there. When tooth decay first starts to occur, it might appear as chalky white spots or lines close to the gums where the plaque sits. In this picture, you can see the white lines kind of scalloping along the gum line there, indicating that tooth decay is starting to happen. And then as tooth decay progresses, the tooth will start to develop the holes or cavitations. As I said, they're commonly called cavities. These holes can be white, yellow, brown, or black, so they don't necessarily have one appearance. In this image, you can see the front teeth have those white chalky lines along the gum lines, but then on the teeth beside the two front teeth, you can see the yellowish brown spots starting to appear where the tooth decay has progressed through the enamel into the next layer of tooth, the dentin. In late stages, tooth decay can progress until a large amount of the tooth structure is gone. This may or may not be painful, which can be difficult for an adult to determine since children express pain differently than adults do. For example, they might have trouble concentrating or have difficulty sleeping, so it might manifest in a different way that we're not used to seeing in adults. In this picture, the front teeth have completely been eroded. And if you look closely, you can see a fistula or like a gum pimple above one of the front teeth, indicating that there's an infection there. At any one of these stages in the tooth decay process, a child might be referred for treatment under sedation or general anesthesia. Out of all the provinces and territories in Canada, unfortunately, BC spends the most on day surgeries for early childhood caries, indicating that this traumatizing procedure is far too common here. This all brings us to the Kohai program. The Kohai program was originally created in 2004 by Health Canada with the purpose of preventing tooth decay in Indigenous children aged 0 to 7, their caregivers, and pregnant women that either live on reserve or access on reserve resources. The Kohai program provides a number of resources and prevention strategies with the goals of treating tooth decay that's already occurred and restoring function to teeth, improving oral health knowledge and oral health related behaviors, preventing tooth decay from happening in the first place, and reducing barriers to different oral health resources. If successful, it's theorized that Kohai can improve a child's oral health and well-being, improve nutrition, sleep, self-esteem, growth and development, speech, and school performance, and with the big goal of setting a child up for a lifetime of oral health, of good oral health. In 2013, the management and delivery of the Kohai program in BC was transferred from Health Canada to the FNHA. 2013 was when the FNHA was created, when it was born. And currently, the FNHA partners with 80 communities all across BC to deliver this program. Kohai is delivered in community by both a dental provider and a Kohai Aid. The Kohai dental provider is a dental professional, either a dental therapist or a dental hygienist, each of which have a different scope of practice. Dental therapists in BC are directly hired by the FNHA. All 6 of the existing dental therapists in BC work for the FNHA. And then Kohai dental hygienists are either band hired, so hired directly by First Nations bands, contracted by a regional health authority, so Vancouver Coastal, Island Health, Fraser Health, Northern Health. so the health authorities that exist in the different regions. However, the FNHA is also currently in the process of trying to recruit our own hygienists to add to the FNHA oral health team. Just very briefly, the scope of practice for dental therapists and dental hygienists are different. So dental therapists have a wider scope of practice when it comes to restorative type of dentistry. They can do permanent types of fillings. They can do extractions, that type of thing. And then dental hygienists work mostly with prevention. They can do some types of temporary fillings, and they also do cleaning of teeth, oral hygiene therapy, that type of stuff. And then my favorite, the Kohai Aids. The Kohai Aid is most often a member of the community that they serve. The role of the Kohai Aid include acting as an oral health champion in the community, linking their Kohai dental provider to the community, directly providing limited oral health services, and being the driving force for oral health promotion. Kohai Aids act as oral health knowledge keepers. They coordinate the Kohai days in the community, and they work collaboratively with the dental provider to implement Kohai services. They undergo training in oral health knowledge, communication, hands-on skills, and a few other things. Most Kohai Aids do not have any type of professional dental background, but some are certified dental assistants. And we've had some Kohai Aids start off in this role and then pursue a career in dental related fields after. And we actually have one recently who's decided to become a dental hygienist. And then there are approximately 80 active Kohai Aids in the province. Kohai Services. So these services are the ones that are provided through the program. The first one being in an annual dental screening, which are done by the dental professional, the hygienist or the therapist, to check children for obvious signs of tooth decay. Number two, temporary restorations that do not require any type of freezing and will help restore tooth function for a short period of time. Number three is sealants, which are a type of material that fill in the deep grooves of teeth to protect them from tooth decay. Number four, fluoride varnish applications, which can be done either 2 or 4 times a year, depending on whether the child is categorized as low or high risk for tooth decay. Number five, the distribution of resource kits, otherwise known as parent kits. Number six, the delivery of information sessions, which can be done either one-on-one or in group settings. And then finally, the referral for any treatment for services that are beyond the scope of Kohai. We're also adding the service of silver diamine fluoride to some of our Kohai communities as an additional option for treating active tooth decay to stop it and halt it and partly reverse it. Of all these services, the Kohai Aids can provide the fluoride varnish. They can distribute the resource kits and share oral health knowledge in those one-on-ones or group sessions. The resource kits that the FNHA provides through the Kohai program are age specific, meaning that each kit contains oral health information and oral hygiene supplies that are relevant and specific to the age of the child. So for example, the pregnancy and infancy kit contains key messages on encouraging the mother to see an oral health provider, information and messages on the importance of good oral health for the mother and the baby, and on how decay-causing bacteria can be transferred to the baby. It also comes with a toothbrush and floss for mom, and a washcloth and a finger brush for baby. And then from the last slide, you could see that Kohai provides many oral health related resources and oral health information, including key oral health messages. Many of these are available on the FNHA website if you search Kohai on the website, so they can be used by anyone. Some of the resources include information on oral care, resources and information for parents and caregivers, resources and information on healthy eating and nutrition, and specific dental health resources. Okay, so in addition to the Kohai Services, communities have utilized the program to implement toothbrushing programs, change community food and beverage policies, collaborate with other healthcare professionals, such as nurses and dietitians, and even advocate for community water fluoridation. Kohai has led to improvements in oral health of children and families and changed attitudes and behaviors towards oral health practices. So why is this? Kohai is unique in many ways. First of all, it is community-led. The FNHA provides the communities with the tools and resources needed to have control over their own oral health. Although the program does have expected deliverables and goals, I live right by the hospital, you can hear the, the ambulance go by. So although the program does have expected deliverables and goals, the way that the program is implemented is entirely up to the community. Second, it builds community capacity. The Kohai Aid is most often a member of the community that they serve. They undergo the training in the oral health key messages and concepts, and then they also learn how to perform the fluoride varnish applications. Kohai Aids work with and for their community to improve oral health. And then third, the Kohai services are most often offered in a community, decreasing the physical barriers to preventative dental services and reducing the need to travel. And then fourth, the program is successful when we successfully engage the families and children. For all of these components, the Kohai Aid is often the driving force towards success. And the more consistent and engaged the Kohai Aid, the better the outcomes in number of enrolled children, number of children to receive a fluoride varnish, and the number of services facilitated between the dental professional and the child. Some communities have also been creative with utilizing the new Pacific Blue Cross dental plan that launched in September of 2019. For example, some communities have utilized the coverage for dentures by having denturists visit the community to outfit community members with new dentures. And then there is an increased interest from both the dental providers and the communities for having dental professionals come into the community to provide services, billing fee for service to the plan. The dental benefits that are now covered by the PBC plan are much more comprehensive than the previous non-insured health benefits plan, improving access to both preventative and treatment options. So this slide just summarizes a few of the differences. The dental exams have increased to 2 per year from the previous 1 per year. The cleanings or the scaling and root planing has increased to about 13 units, which equals about 3.25 hours worth of cleaning. So probably about 3 to maybe 4 cleaning appointments in a year. Fluoride varnish, 2 treatments per calendar year with no age restrictions. Previously, there was an age restriction. We know fluoride's beneficial for anybody at any age. Night guards are eligible for coverage. Like I previously said, dentures have an increase in coverage and frequency of coverage as well. Bridges, crowns, veneers, inlays, and onlays are eligible with no prior approval required for up to a $4,500 combined limit within a 5-year period. And then the white fillings are also eligible for coverage. So Kohai can take place in a number of community settings, including health centers, schools, in a dental room or a dental clinic, daycares, or through home visits as well. Schools as well as health clinics provide a lot of opportunities for our Kohai providers to kind of piggyback on delivering Kohai services. An example could be with the immunization clinics that nurses do, where the nurses will book appointments with the children for the immunizations and then refer them to the Kohai provider for the screening and or the fluoride varnish application. This is an image of an outdoor health fair that a community held, and they included a Kohai booth. They had set up a photo booth with props and a game for people to play. For this community event, the Kohai Aid helped to connect the dental provider with the community by informing them about the event and helping to coordinate the schedule of the dental provider so that they were able to attend. Creating a really great opportunity for the community to connect with both the Kohai Aid and the dental provider, really building that oral health presence in the community. And then this is an image of a health fair at a school where Kohai set up a booth with information, resources, and oral health supplies, toothpaste and toothbrushes, and probably some floss in there. And then this is an image of Carmen, one of our Kohai aides, engaging children in an oral health discussion. This is an image of Melanie, one of our FNHA dental therapists. This took place during one of the Gathering Our Voices events that brings together up to 2,000 Indigenous youth delegates to explore, learn, and engage with culture among their peers. So you can see, again, we've encouraged an oral health presence. And then this is our dental therapist, Kim, and many of her Kohai children. Kim is very well accepted into the communities that she serves. Our FNHA dental providers have made commitments to demonstrating cultural humility, helping with strong rapport, and practicing with compassion and kindness. And then this is an image that really demonstrates how Kohai can literally take place anywhere. This was fairly recently, I believe just a few weeks ago, where our Kohai team did screenings and fluoride varnish applications in people's driveways. They packed up a portable chair and table and go driveway to driveway, following strict infection control protocols for each location to provide these services literally at the door. These are all really great examples of how a community can take Kohai and really run with it, incorporating it into everyday life and into the community. I do have a couple of messages from a couple of the Kohai aides who wanted to share a little bit of their experiences. The first message is from Lottie, who is a Kohai aide for the Halal and Layaxan communities. She's been the Kohai aide there for 4 years, and she says, I previously had grandparents express appreciation for the hard work we do as part of the Kohai program. They say, we don't watch our children suffer with all the pain and decay and missing teeth. Thank you for helping care for them. She says she strives for the best possible care for their children, as they deserve to have healthy, happy smiles and live pain-free. And then I have a message from Carmen, who is one of our Kohai Aid superstars from Penelakut Island. And she says, Kohai has built capacity within families that have been impacted by intergenerational trauma and helped them move beyond the legacy of residential school. Kohai nurtures families in their learning and healing journey and teaches them how to provide loving care through oral health wellness. Through Kohai, children can receive culturally safe care in the comfort of our community, so individuals have a safe place to access services. The program has had a remarkable impact on the reduction of caries and hospitalizations and the improvement in the oral health outcomes for the community's children. After a few years of having Kohai in the community, children are so excited to see us and the good feelings created around oral health care, and this is the rewarding part for me in my profession. So I want to just take a brief moment and reflect on my own gratitude to work with and support the people who are so passionate and kind, making a difference in their communities. I've learned so much from them. My role is very meaningful, and I feel really great about trying to help communities and individuals achieve their best oral health possible. These are a couple of pictures from one of my last trips that I took before the pandemic. The left image is on my way to a very quiet, remote, natural hot spring. And on the right was me driving down the highway, no reception, but just totally enthralled with the beautiful surroundings. So in summary, I want to reiterate the benefits of community-led initiatives for health, and in this case, oral health, to continue to improve the oral health of First Nations children and families. Many of the tools and resources that I've discussed here today can be used and applied. I really do believe in the power of passion and compassion in making a difference. And our programs, our dental therapists and our Kohai Aids really demonstrate that in ways that I can't fully put into one presentation. I encourage everyone to advocate for health and wellness for themselves and for others. So now I'm open to questions and discussion, and here's my contact information if anybody would like to reach out to me directly.
Awesome. Thanks very much, Ashley.
Thanks.
We'll make sure to any resources that were referenced today, we've taken a note of them, and we'll make sure to share your contact information here as well, so people don't have to go hunting through resources later on to find it, in case that's what you're interested in. So we have a couple questions here that I'm going to ask now. The first one being more of a general question regarding, earlier in the conversation you spoke about barriers. And this question is, how do the barriers differ in your opinion, or the research that you've seen? How do the barriers differ between on-reserve versus urban Indigenous people in accessing oral health care?
That's a really great question. The biggest reason that really jumps out is rural and on-reserve communities. They have the actual physical barrier of not having dental care in their neighborhood or nearby. So they have to physically leave the community sometimes and often to receive care. And there's also more options in an urban center to access different care. So perhaps in a rural community or a remote community, there might only be one or two dental offices nearby that they can go to. And those offices, if they're not culturally safe, people might not be all that thrilled to go to those dental offices, and that in itself can be a barrier to care. Whereas having more options and having an increase in cultural sensitivity instilled into dental practice can help reduce those barriers.
Mm-hmm. Yeah. Okay. Thanks very much, Ashley. I appreciate that. Yeah, of course, in rural communities, you're going to have that, those lack of options available. So that's really important. Thank you very much. So then we're going to kind of jump ship a little bit here. And this one, I imagine, comes from someone that has some hands-on experience. For those kids that really don't like brushing their teeth or really don't enjoy brushing their teeth, what are some preventative measures to prevent tooth decay for them that you would recommend? Are there other things that they can do, other tools that they could utilize to help with this?
Yeah, this is sometimes, and I realize that it's probably not the most popular answer, but sometimes we do have to do things for our children that's good for them that they don't necessarily like. For example, using a seatbelt or like a safety chair. I think that's what they're they're called in a car. So
Okay.
it is really important to get into the mouth and remove that plaque and get the fluoride onto the teeth to help prevent the tooth decay. But in addition to that, you can also be seeing a dental professional, getting the professional fluoride varnish applications. It takes seconds to apply, and it is a preventative measure. But what really makes a difference is the daily home care.
Mm-hmm. Yeah. So yeah, I love the way that you put that. Sometimes we have to do things that our children really don't enjoy for their overall, for their betterment. So
Yeah.
I think we've all been there for that.
Yeah. I also, it might be rough at first, but if you do things consistently enough, you can build those habits and you can build a comfort around oral hygiene and dental care at home.
Yeah, for sure. It's like anything else, right? If you make it a bit of a game or you make it into something that's fun or rewarding in and of itself to begin with,
Totally.
eventually those habits build.
Yeah. And if a child is old enough, you can have them practice brushing their own teeth at first. And then you could go in and finish it off and take turns. Or the other way around, you can start off and then let the child finish. And that way they're also building some of their own autonomy and they might not feel quite as maybe pressured or afraid or bothered by the toothbrushing.
Yeah, for sure. I think there's, kind of even within this question, and I think it's a great one, honestly, but even within this question, we can kind of start to see these kind of, what I would see is difficult perceptions of the importance of oral health. I know that we've all been there. I myself, I don't know if you know this, Ashley, but I have 9 nieces and nephews, all under the age of 5. So I am acutely aware of how much some of them really don't like brushing their teeth. And I get that, you come home at the end of the day or at the end of the day, you're really tired and trying to get to bed. And I get that it's a big deal, but I think just recognizing the importance, like just how important it is that every, that they brush their teeth.
I do recognize that oral health isn't necessarily the biggest priority for some people if there are competing priorities that are very important to them. You can only really thrive when you have other components of health and wellness in place. But I hope that through education and through really showing people compassion and care and meeting them where they're at can help put people on a good track towards achieving the best oral health possible for them and their families.
Great. Thanks, Ashley. Similar question or similar vein, with Halloween coming up right around the corner, do you have any recommendations for candy intake? Is there anything that we need to be watching out for, particularly consuming high amounts of sugar? Anything that we need to be aware of?
I like that question. The biggest contributor to tooth decay is actually frequency of sugar intake. So it has less to do with the amount of sugar that you're taking in and more to do with how often you're taking that sugar in. Because if you eat a bunch of sugar all at once, you get one of those acid attacks on your teeth, and then your teeth have a chance to remineralize and recover from that acid attack, and they're just fine. But if you are constantly snacking on your Halloween candy throughout the day or for multiple days, depending on how much candy you got during Halloween, your teeth are not going to have a chance to recover from those acid attacks, and it can contribute to tooth decay that way. So probably not a popular answer, but eat all your candy all at once. don't snack on it slowly throughout the day.
Yeah. Okay. With respect, Ashley, I probably won't tell my 5-year-old they can eat all their stuff at once. Yeah. But that's really interesting. It makes complete sense now that we link it to the metabolic process. But yeah, I definitely wouldn't have thought that. So thanks very much. Cool. Okay, so this one more of a technical question regarding the benefits. And we had someone ask, do FNHA dental benefits include Invisalign or braces?
There is some coverage for orthodontics, but I don't have the specific information for that. So if they want to send me an email, if that individual wants to send me an email, I can link them up with the right people to answer that question.
Great. Awesome. Thanks, Ashley. So then we have one other question that's a little bit, it's a longer question, so just bear with me for a moment here. But Evan asks, how has SDF been adopted in BC First Nations communities? Evan expresses that he knows that it's slow picking up in Manitoba and Northern Ontario, but there's some resistance due to the aesthetics while arresting carries. Also, as you mentioned about the 2 visits provided a year, how often are these 2 visits actually utilized? So perhaps within that, there's a conversation or a question about, how much are we kind of trying to make these dental services more available, beyond just providing coverage for 2 visits, as we spoke about earlier, with rural communities that maybe just, the dental office is like, X number of hours down the highway or what have you, right?
Yeah. I will start with the SDF half of the question. So we just very recently started the process of rolling out SDF through our FNHA dental provider. So through the dental therapy program that we have, we realized that it can be, some people are sensitive to it because it does stain teeth black. But we have developed an internal and an external engagement process. So we held webinars with health directors and other community members to explain to them what SDF does, its pros and its cons, because it is really great at stopping tooth decay and preventing children from undergoing surgeries under general anesthesia, but aesthetics can be a concern. So it's important for people to be aware of that ahead of time, the pros and cons, as well as understanding that, and then also with our internal engagement strategy, we've talked with our dental providers, we've had hands-on training with the process of actually talking with individuals, showing them pictures, explaining that they have every right to consent or decline a certain treatment, and to also put it into a comprehensive treatment plan as a treatment option. So it's not necessarily this or nothing. It might be one option, something that can hold a tooth in place until it's ready to fall out, or something that can be done if a child is waiting to have multiple appointments. So it might be a temporary thing in place just to keep a child out of pain until they can get definitive treatment completed. And yeah, I think it's also important to note that it's not just being offered through us. It's also offered through dental offices as well. So it's been around in Canada since 2017. It has taken a while for it to kind of roll out the door. But we wanted to be very careful in how we present this to our community partners and our clients, and empower them with another tool to help reverse tooth decay and take control over their health with another treatment option.
Great. Okay. And just to confirm, the SDF is silver diamine fluoride, right?
Yeah. Yeah. And there's an information fact sheet on the FNHA website about it as well.
Okay, great. Yeah, we'll make sure to include those in the post-session resources then as well.
Awesome. Yeah.
Okay, so the questions are actually just starting to flood in here. So Katrina, Ashley, thank you very much for an informative presentation. In your opinion, what is the single greatest factor that contributes to the success of this program? And what additional resources would you welcome to continue the great work that you're doing through the Kohai program?
Okay. What is the single greatest driving successful factor?
Yes.
Success factor. I really believe that it has to do with the fact that the program is community-led, because the role of both the Kohai dental provider and the Kohai Aid, they really incorporate themselves as a presence in the community, and they can leverage the program to benefit the community in their own unique ways. In that way, it's also it's also culturally sensitive because you actually have a member of the community who understands different community practices, potentially different cultural practices, and because they're advocating and they actually know the families and they care, they're able to really meet people where they're at and encourage them and have important conversations about different ways that families can improve oral health.
Mm.
Yeah. And then what was the second half of that question?
Yeah, for sure. Sorry. What additional resources would you welcome to continue the work?
What additional resources? I would like to see an expansion of some sort, and an expansion of different options for First Nations clients. So we do have the Kohai program. It's fantastic. I really love it, but I would also like to see more community capacity building with or without the Kohai program, where communities are able to have the tools and resources to run their own programs, or take their own initiatives in providing preventative oral health care.
Mm-hmm.
Yeah.
Be more oh, the term is escaping me now. Self-determination as it relates to their oral health, right? I think that's the end goal of everything that we're doing here, so that our communities, our nations can be self-determining and healthy in a good way. So yeah, totally. I appreciate that answer. Thanks, Ashley. Okay. Sorry that this seems like a barrage of questions.
Okay.
So we have a question. My wife is pregnant. Is there anything different regarding preventative measures? And is there anything that we should be aware of?
It's really important for pregnant women to take care of their teeth and their mouths, because there is a connection between the inflammation in the mouth and the health of the baby. So I would encourage her to reach out to a dental professional and see if maybe she should get in for a cleaning. And there's different recommendations, and I can't quite speak to them right now,
Sure.
but
yeah.
Okay.
Yeah, that's fine. I think we all understand the importance of seeing a dental professional and chatting through your case as an individual, right? And receiving that individualized care. So
yeah,
yeah, I can appreciate that.
Okay, thanks.
Okay, so we'll have a couple more questions. Firstly, real quick, what are some of the ways the FNHA can help with the additional costs of seeing a dentist if you live remotely? So the same situation we've been chatting about, if the dentist is a little ways away from your community, are there any additional supports the FNHA offers to allow you to actually get there?
Yeah, there is our medical transportation program. I'm not super familiar with it, but if that individual wants to email me, I can try and provide them information and connect them with the right people.
Okay, great. Medical transportation program. So we'll also include a link to that as well, or try and find some resources.
Sure thing.
In the post-session chat.
Okay.
And then the last one being, how can I get in contact with a Kohai representative, chat about bringing the program into my community? What does that process look like?
Again, I would recommend that they shoot me an email and we'll look into some different options.
Okay, awesome. So thanks very much, Ashley. You're an amazing resource. I really appreciated your presentation, your years of experience and your knowledge. Thank you so much for sharing them with us today. As is customary, last couple minutes here, I'm going to do my little plug. We have a really big November coming up at the Learning Circle. We have events, excuse me, just give me a moment to pull up the list here. We have events starting with the Elder Series. We'll be chatting with Elder Roberta Price is going to come in. We also have a session on the Indigenous Public Health Program offered at UBC. We're going to chat with the program representatives and talk through that. We also have a session on sport concussion in Indigenous youth. We're really excited about that. So we're going to talk about prevention and recovery, proper recovery from a concussion in sport. And then finally, we have a session in combination with Ursi, welcoming Priscilla Setti to the Learning Circle to chat with us about her work in the North. So again, thank you so much, Ashley, for being here with us. And thank you everybody that participated. We really appreciated all of the wonderful questions and kind of active contributions to the session. It made it for a really engaging hour. So thanks so much again. Until next time, everyone, take care.
Thank you for having me.